The Abel Obasogie Foundation don't take proactive steps for promoting health education as dem bring their cancer awareness campaign enter Kiddies College group of schools wey dey number 158 Upper Igun Street off Benin City. Dem initiative na to teach students and teachers about the danger of cancer, wetin dey cause am and how to prevent her. TMC TV tori person Destiny Godaro report say the awareness campaign dey well received as students and teachers participate wella, ask plenty important questions about the disease. For the event, Dr. Augusta, one of the representatives of the foundation, explained say cancer na condition where abnormal cells dey grow without control and it fit cause serious health problems. She talked about the different causes of the disease like genetics, poor diet, tobacco use, too much alcohol, infections, exposure to harmful chemicals, obesity, and no enough physical activities. To help control and prevent cancer for society, Dr. Augusta come advise students and staff to adopt healthy lifestyle like eat balanced diet, exercise well, avoid tobacco and too much alcohol, and take vaccine for cancer-related infections like HPV and hepatitis B. She also talks say early detection, regular medical checkups, and protecting yourself from too much sun dey important.
Many of us know it as something that is very dangerous, something that is very scary, and we must have heard of people that passed away from cancer or from TV, people are soliciting for funds, and it's like it's a burden on everybody because whenever anybody has cancer in a family, everybody feels it because it drains the finances of the family, and coupled with the fact that we are in Nigeria where we don't really have access to funds for healthcare, so it affects the family, and that is why we need to know what cancer is and what we can do to prevent it. So cancer is when cells in the body start to grow abnormally. Normally in your body, there's a cells divide, they die when they're supposed to die. They are all, it's like a coordinated process. It's a normal thing that goes on every time because if there is no control in place, cells can just begin to grow, and that is what happens in cancer. The mechanism that controls the way your cells divide and when they die, it stops. And so just like maybe you have maybe a pet that you tamed at home compared to a lion that is growing in the bush, there's a difference between the dog that you tamed at home. Do you understand? Are you following me? Yes. Are you sure? Yes. Okay, so in cancer, it's like the lion that is wild in the bush. You can't tame it, so you cannot even bring it into your house. So cells can no longer die when they are supposed to die, and so they just start to multiply. And that is what we call a tumor. But you have to know that not all tumors are cancer. The ones that are cancer are the ones that can spread to other parts of the body, and that is why it's very dangerous. Somebody can have cancer of the breast, and it can spread to your spine, to your bone, to your legs, everywhere because of how deadly it is. There's no regulation mechanism in place. They are bigger than, it's just like, they are bigger than the regulation mechanism. They don't listen to anybody. They are unruly, they are stubborn. That's what cancer is. So that is what happens. And there are different types of cancers. Who can tell me any cancer that they've heard about before? Anybody? Breast cancer, that's very nice.
Breast cancer,
prostate cancer, skin cancer, brain. So every part of your body, every part of the body can be affected by cancer. The common ones we have is breast cancer, and I know some of us will think that it affects only women, but everybody has breast tissues, both male and female. It's just that it is more common in females. It also affects males. And then the prostate cancer that she mentioned. Who has a prostate? Anybody? Who knows who has a prostate? Men. So that means it affects men. Prostate cancer cannot affect women. And for prostate cancer, it majorly affects elderly men. So with increasing age, the risk for prostate cancer increases, as well as for breast cancer. With increasing age, the risk for breast cancer occurs. Then there's also cervical cancer. Who knows? Who has a cervix? Who knows who has a cervix? Do you even know what a cervix is? Okay, it's in the female reproductive tract, so it affects the females. It's a very common cancer that happens. It's a very big burden, especially in Nigeria. Breast cancer, cervical cancer, prostate cancer. There is the lung cancer affecting the lungs. And when we see cigarettes, we see something smokers are liable to die young, so that is like very associated with cigarette smoking. Then there's liver cancer. Basically every cell in the body can be affected with cancer. Are you following?
Yes.
Okay. So for cancer, there can be symptoms that can be telling of cancer. It does not mean that if you notice any of these things that you have cancer, but because of how it's like a very chronic disease. It does not just come once and start and show you that it's cancer. When by the time you start even seeing symptoms, it's like at the end stage that really nothing much can be done. The common symptoms that we can see from cancer is unexplained weight loss. What do we mean by unexplained weight loss? You are eating well, you are not on any weight loss plan, and the person is just losing weight. You just see that your clothes are starting to get too big, and it's not as if you did anything to lose weight or you are doing more strenuous activities. That can be one. Then if you have abnormal bleeding from your, maybe when you are brushing your teeth, you start seeing blood when you spit out, or your period is abnormal, or you are just seeing blood that is not normal, it can be a sign. If you are having bone pain, that is bone pain, it is not normal. It does not mean that all these things are cancer. Do you understand me? But this can be telling. That's why anytime you notice anything that is abnormal in your body, like a breast swelling, a swelling in your armpit, in your neck, you have to tell your parents, and so that they can take you to the doctor. It's better for you to be checked, and they will tell you that there is nothing wrong, than for you to now grow and become very big. Then that becomes uncontrollable. Because there is something with cancer. We keep saying that early detection is the key. It is what saves lives. When you the outcome of cancer treatment is dependent on how early you catch it. And that is why when we talk about breast cancer, we talk about self-breast examination. Have you heard about it before? Okay, it is the examination of your breast every month for the females. If you do your self-breast examination every month, you'll be able to detect if there's anything abnormal. That is why you have to do a regular check. And if you see that on your body there's any wound that is not healing, any new black spots or anything that is abnormal in your body, report it to your parents, report it to your doctors. Just make sure that you pay attention to your body. As a person, it's very important that you pay attention to your body. You are not just careless. You know, if you're saying you're seeing your period, you know how your period goes, and if it's out of the abnormal, you know to report it. You know how your breast looks and feels. If there's anything abnormal, you report it. Then you know if you're feeling pains in your bones, or you are feeling unusually tired. That is even after you have rested. Maybe you just woke up in the morning and you are feeling very weak and very tired. That is not normal. So you are supposed to report that. And it's not only about you. It's also about your parents, people that are in your house. You also, this thing is not something that one person can fight. We all have to come together to fight cancer. So you have to be your brother's keeper, your sister's keeper. If there's anybody around you that is noticing any of these things that are abnormal, you have to advise the person. There is no one cause of cancer. You cannot just say that this is the cause of cancer. Like we say that malaria has a cause. Who knows what causes malaria? Thank you. So that's with malaria. But for cancer, we cannot just say that this is what causes cancer. But there are a couple of things that can increase our risk for cancer. That question she asked brings me to family history. It's not as if because somebody's father has had it, the person will have it. It's just that because the person's parents or sibling has had it, there's an increased risk for the cancer. Like breast cancer, cervical cancer, prostate cancer, a family history is a very, very strong factor. Cigarette smoking, and that is very, very much associated with lung cancer. But it's not only lung cancer that cigarette smoking is associated with. Cigarette is a toxin. There is no benefits for cigarette smoking, so it is like a very, very deadly thing. If you are smoking cigarettes, it is like you are intentionally setting just like burning yourself by yourself. That's what you are doing to your body. Another thing is alcohol smoking. In the past, we used to say that there's a certain amount of alcohol consumption that is okay, maybe in a month or in a day, in a week. But now, the current talk is that no amount of alcohol is good at all. Alcohol is a very, very strong risk factor for developing cancer. Then exposure to chemicals can also cause cancer. Then if you unhealthy eating habits can predispose you to cancer. So if you're always eating junks, it's good that you put that in check. And you eat healthier. What do I mean by eating healthier? Eat more whole foods, eat more fruits and vegetables. The closer a food is to nature, like your yam from the ground, your fruits from the trees, the better it is. So you limit those shawarma, hamburger, pizza, those kind of things. They are processed foods. So another thing that we can use to that we can look out for is keeping fit. It is not advisable that you just stay and you don't do anything. Make sure that you are doing something that you love. So if you love dancing, incorporate that in your daily routine. It's a form of exercise. If you cannot dance, you can run. If you cannot run, you can skip. If you cannot skip, you can just walk. The recommended is 10k steps a day, but even if you cannot do 10k steps a day, you can just walk around your compound, walk down the street. Just make sure that every day you are being very, very active. Any exercise at all, any sports at all, is a very good thing. How we can prevent it. So a way for breast cancer is that monthly self-breast examination. Then for cervical cancer, there's something that is called pap smear. So that is a way that you can be caught on time by screening. And there's a vaccine for cervical cancer prevention. The vaccine is against the human papilloma virus. That is the sole organism that has been implicated in the cause of cervical cancer. So who is to take this vaccine? It is both boys and girls, not for only girls. There are vaccines available. So talk to your parents and they can talk to your doctors and you can take the vaccine. It's very important so that cervical cancer can be prevented. This is one cancer that is easily prevented because there is a vaccine. Then for the liver, hepatitis can cause liver cancer over time because of the chronicity. So you can also prevent that one by taking hepatitis B vaccine. It is available, so you can talk to your parents so they can take you to the hospital to take your vaccine. And then once again, I would like to say that early detection is a very, very important thing when we talk about cancer. Without early detection, the chances of survival is very low. So the earlier cancer is caught, the easier it is to be treated. You can see that the sun is very hot. The UV rays are very, very damaging to your skin. So as much as possible, avoid being in the sun. If you are going to be in the sun, wear long protective clothing, use your umbrella, your face caps, your sunglasses, and then sunscreen.
During the event, students come talk say them appreciate the awareness campaign. Natasha, one SS3 student, talk say one of the best way to prevent them na to go see Dr. Ellie wey fit stop cancer from spreading. Another student, Chiamaka, talk say early detection are the key to fighting cancer. She also explained different causes of cancer and how to prevent them. Olufemi Kayode, another student wey participate, come talk say cancer na disease wey come from the irregular dying of cells and come urge people say make them support cancer patients. He come also call on government to make sure say hospitals get better vaccines and facilities to improve cancer treatment.
Today has been very enlightening. I got to learn a lot of things I didn't know before about cancer. Learning the actual definition of cancer, that it is a disease where there is an abnormal growth in cells. Learning the various causes of cancer, like overdose in alcohol or smoking, unhealthy diet, and unhealthy lifestyle. Many ways to cure the cancer include like a healthy lifestyle, proper diet, avoiding alcohol completely, and also avoiding smoking as well. I learned about skin cancer, learned that an unhealthy amount of the UV rays can cause skin cancer. That even having cancer in one place, it can even eventually spread if not checked properly and not prevented. So that's why the one way to defeat cancer is to detect it early on, to have an appointment with a doctor so they can give the proper treatments and stop further spread of the cancer.
You know that early detection is the key to fighting cancer, because when you detect it early, you might be able to fight cancer. But when it's over, when it has already grown abnormally, that it has already spread to different areas of the body, you can't control it. And also, when you detect it, for example, if somebody has been free from cancer, the cell of cancer has been neutralized. For example, a woman suffering from breast cancer on the right side, if it has been neutralized on the right side, doesn't mean that she is free from cancer totally. It can also affect the left breast or any other places, the eyes, the stomach, the body, and everything. And also, I also learned that when you're coming outside, also take out your umbrellas, wear sunscreens, and also They also told me about melanin in the skin, that we are also different from the Caucasians because of the melanin in our skin. And the melanin in our skin is not 100% effective. It cannot protect our skin effectively. So we have to apply sunscreens, and also take note of the sunscreens you are applying. Your skin might be allergic to some of these sunscreens. When you are coming outside in the sun and you are unprotected, the amount of UV rays directed from the sun towards your body can give you something. You can also maybe swelling on your skin, or dark spots, or abnormal lumps on your body can also cause cancer. So when you are looking for vitamin D from the sun, always come out early in the morning to take the vitamin D from the sun. And also when coming out, stay protected, as I already said.
Cancer is like a disease, irregular growth and dying of the cells that causes a tumor. Not all tumors are cancer, but all cancers are tumors. Tumors can be treated in different ways. We have chemotherapy, we have surgery, we have a lot of that. One very important thing I've learned about cancer is that if someone has cancer, we have to help that person. Like, we have to come together as a family. Just because he has cancer, we should just abandon him for him to treat him on his own. I also think that the government should also improve a lot of hospitals to be able to treat all these type of sensitive patients.
Kenneth Obasogie, CEO of Abel Obasogie Foundation, thanked Kiddies College Group of Schools for giving them chance to educate students about cancer. And talks say initiative like this go help make society dey more healthy. Dr. Owusa Komosu talks say government need to intervene sake of say cancer treatment too dey expensive for most people. She can call on government say make dem place importance on top funding and resources to improve cancer care for the whole country.
Here we are in Kiddies College at Igun, Benin City. We came to educate some of their students about cancer awareness, and I'm so excited because the students they were wonderful. They give us a warm welcome. They listen to us, and I believe a lot of them they learn a lot. I want to thank the management of the school for giving us this opportunity to come here to come and educate their students about cancer.
So it's important that the government comes to collaborate with individuals to fight against this cancer, because one person cannot just manage cancer. It is very, very draining on the finances. It is very expensive to manage, especially here where we do not really have health insurances. Most people pay out of pocket, and for cancer you cannot really just pay out of pocket. Some of these cancer medications cost millions per dose, and that is why the government has to put more things in place, put health insurances in place that can help individuals manage cancer, because in better climes you don't really pay out of your pocket to treat cancer. There are insurances in place that help people live with, like, if cancers that you think that people cannot survive, people live with it because things are in place. But in Nigeria, we do not really have that luxury, because most of the time there is no money. People are crowdfunding. We see a lot of times people are saying that, oh, help me, I need some money. So that's where the government really plays an important role, by putting so many things in place, putting health insurances in place that are functional, that can help the individuals and lessen the burden on the society.
Initiative like this wey Abel Obasogie Foundation lead dey important to raise awareness and empower the younger generation with knowledge to prevent and fight cancer. By educating both students and teachers, dem dey help create healthy society wey sabi more. We hope say this campaign go inspire more communities to take action, put health education first, and work together to reduce the impact of cancer. Make una no forget say, as we see am, na so we dey talk am. We know the take blame. From Benin City, Ekata Ojesole, TMC TV News.